All right, well, we have a treat for you guys now. What we've done is we've found some of the top physicians here in the Metro Nashville area. These physicians are award-winning. They've been recognized by their patients. They've been recognized for their abilities as far as their procedures that they perform. They're just a really great group, and they're going to have a lot of insight to share with you guys, because I think one of the best ways that we can learn is from people's successes and even some things that don't quite work out. So I'm excited to introduce to you guys today to our expert panel, and what I'd like for them to do is to each go through, introduce themselves, tell you who they're with, a little bit about their practice, and to begin, just to share with you what their top marketing tip is based upon their experience.
Well, hello everybody. Am I on?
Oh, let's see, it may take it.
Maybe battery.
You're on. You just have to speak directly into it.
Okay, how's that?
Perfect, perfect.
My name is Dr. Kellye Rice, and I'm a general and cosmetic dentist in Cool Springs. I've been in practice since 1986, and when I started, I really feel, when I look back, I look at Valpak as a direct mail piece as being really our bread and butter when we started out. That was before cell phones, I do believe. So we've embellished our marketing since then, but when I think about my top marketing strategy, or the thing I always like to remember, is that while you may not be the person to jump right into TV or to radio, you also can't just rely on direct mail anymore. You have to really have all the table legs there to support your business and to support what you want to say to your public. So that's what I think of.
Hi, I'm Melinda Haws, and I am a plastic surgeon. I'm in practice with Mary Gingrass. We've been in practice here for almost 13 years in Nashville. She's been here since '95. I was in practice somewhere else a long time ago, for 4 years. What we have found when we started our practice together in '02, we were one of the early adopters of a website for plastic surgeons. If you don't have a website, you have to have a website. If you do have a website, you have to keep it updated. You wouldn't dream of going to a new restaurant that didn't have a website. You'd think they were sketchy. Plastic surgeons, doing primarily aesthetic surgery now, we have had to kind of be ahead of that curve. And if you don't have a website that people can relate to, they don't trust you.
I'm Dr. Mary Gingrass, and the only thing I would add to that, we co-market, and that, I think that's difficult for a lot of practices, but what we really try to make sure that we don't undermine each other, and we are always mindful to be promoting each other, and I think that's something that if you're in a group, you really have to think about. And besides website, I felt like we were a little bit ahead of that game, 10, 15 years ago. And right now, I think the big thing that you could be a little bit ahead on is reviews, because you just all you have to do is come to work and take good care of people, and you grew your practice by word of mouth. Well, now word of mouth is on the internet, and word of mouth is reviews. So I think that's another thing that you have to keep you can't just put a website up and ignore it and update it every 10 years.
My name is Scott Harbin, general and cosmetic dentist in Hendersonville. Opened in '08, so been open about 6 years. I would say probably the number one thing that I got on really early was AdWords. I met Karla and Costas and got really lucky, and no one was doing it at that time. I really rode that wave, but I do think the new game is definitely the reputation management. But the AdWords is definitely, if you're going to start with something, I think that's the low-hanging fruit for sure.
My name is Tyrella. I am Dr. Michael Bergdorf's practice manager. He had to step out early, so I'm taking his spot. But we opened the practice in 2012. He's a plastic surgeon. He was, before that, with another doctor. I was the receptionist at that practice. And we just kind of he decided to open his own practice, brought me with him, and we've learned this marketing together and monitor it very closely together. We definitely fully believe in the website. You've got to have a website. It's got to be credible and establish your authority and things like that. But one of our biggest, we feel that has made us more successful has been the consistency. So the amount of education we put on our website, we carry that through in the office. When a patient calls, our staff is trained to just back that up the whole way through. We want that experience to carry through every step of the way. So if you're going to educate your patients and take the time to make your website look really nice, that experience in the office should follow through with that.
Great. And though we just learned several wonderful marketing tips from you, Dr. Wang, is there a top favorite, or is the focus really on differentiating?
We offer surgery for all age groups: younger, LASIK; middle age, forever young lens surgery; get rid of reading glasses; older patient, cataract surgery. My number one pearl is seminars. I will ask your audience a question. Guess how many seminars, which is very road less traveled. Most of surgeons, eye surgeons, don't care to go out. I think the time has passed. We sit back and patient gonna come and tell us. No, we have to reach out. And that's my number one pearl. Guess how many seminars I hold? Audience size per seminar, 30 to 50 per month. I personally go out to give a seminar. Guess a number. 20. Not 20, that's too many. Per month, probably I go out on average 2 to 3 a week. So that's very, very atypical. That's probably world record of any eye surgeon who care to go out the community and educate. So educating with seminar. I have a question I'd love to learn today. How to do social media.
Well, each of these different physicians and representations from these practices have talked about investing in their marketing and different things that they've done, but why did you choose to do that to begin with? Why was it worthwhile for you to spend your time, your finances? What's the benefit to you in doing your marketing?
More business.
Well, in the beginning, when you're just starting out, you have to get the word out about who you are and where you are and what you're doing. And so that was back when there wasn't much internet, but I still think that no matter the modality, you have to get your story out about who you are, what makes you special, so that you can prick the heart of the person that you want to have as a patient or a client.
You know, we all are surgeons or dentists, and we love what we do, and we want to do what we do. And you have to make sure people are aware that you do what you do. When we started, you built your practice by word of mouth, you built your practice by going to the emergency room and taking care of people. Well, it's not like that anymore. People don't go to who they see in the emergency room to get something done because they're an emergency room doctor. They get on the internet, they research whether it's cosmetic dentistry, whether it's getting a facelift, whether it's getting their breast done. They get on the internet and see who pops up. And just like going to the restaurant, they check the reviews. And do you have to have all positive reviews? No, but they gotta be mostly positive. So we do what we do to be able to keep doing what we do, and we've tried to be proactive about it, but if we wanna stay busy, and we wanna be as busy as the non-board certified physicians who are doing what we do, even though they're not trained to, they're all advertising. Unless we educate the populace, they don't know.
What I like to do is operate on people and for the goal of making them feel better about who they are. And I market to differentiate myself. And why should they come to me? So that's why. Why do that?
I think it's probably like the best return on investment of anything I do. We spend about 5% of sales on it. Average dentist office probably gets 20, 30 new patients a month. Last month we had 215. So it's like we've kind of taken that off the table to where now the limiting problems are like having enough rooms, enough providers. So, and as you get good at it, your practice grows, you have a bigger budget. It gets really hard for the guy next door to try to compete with that. So it's something you got to learn to do nowadays.
For us, we were a new practice, so the word of mouth referrals are always the best or the most credible, but that takes time to build. So for us, we needed to get in front of our patient base and let people know. And we've recently moved from Franklin to Nashville too, so that's another thing we had to let everybody know. So now we're in the Nashville area, and we wanted to let patients know about that, but let them view us as a resource. And patients nowadays are very savvy, and they want to know, even if it's a cold or a flu or whatever, they want to know why and how to treat it, and they're researching these things. So especially in plastic surgery, they're looking into that stuff. So we want to educate them about the things that we offer, about the treatments that we have, and what makes Dr. Bergdorf an expert in it, his training, his credentialing, and things like that.
So what has been your biggest lesson learned? Obviously, there's different techniques, there's different ways of investing money, different ways you experiment with your marketing. What's been the biggest lesson you've learned that if you could share it with the physicians and businesses who are here, that would save them some pain or help accelerate them to where they want to be, what would that be?
We would say do it right the first time. When you're starting out with a business, Dr. Wang touched on this, when there's not as many patients, there's not as much money for marketing. So you want to get as much as you can with a little bit of money so that you can make it go further. And we unfortunately learned the hard way that with a company who is significantly less than another company, there's a reason for that. And we went through a phase where we had a website, it was mediocre at best, the SEO was terrible, and we had to completely start over, and we're in that phase now, and we're seeing, we've put a lot more money into it, but already it's been exponentially better. So I would say, look at your options and don't just throw money out the window, but if there's a reputable company that you need to work with, or something that you're gonna have to put a little bit more into, if you're gonna get it back, then I'd say do it the first time instead of spending your money twice on the same thing.
I'd say probably the main thing is real fundamental, like you have to track where everybody's coming from. So if your front staff's not asking, how'd you hear about us, and recording that, you really don't know what you're doing. If you're not tracking it, really doesn't matter. And then I think your staff up front should have scripts, because marketing basically just makes the phone ring. So once that happens, that's kind of up to you, and you can get a bigger percentage on those dollars if you're tracking that and you have good scripts in place.
I would say the biggest thing in today is to get help. I think for a while we kind of tried to do it on our own and tried to have this person, this nurse, and that nurse, and answering this and that and the other thing. And it's a pretty cutthroat world out there now, much more than it used to be. And I think you do probably need to.
Yeah, speaking of one of the mistakes she and I made when they let us out of the office by ourselves to actually make some marketing decisions. We're an expert at plastic surgery. We're not an expert on the internet. We're not an expert on marketing. We're all experts at what we do. So unless you're a marketing expert, go to the expert. We use aesthetic brand marketing to run our website, and they manage our SEO and help with all those things. She and I go to a meeting and get this rush sell job from a group called Yodel, that they're going to look at what is not being hit on our website, and they're going to have a mirror image of our website, and they're going to add other words, and they're going to pick up what we're not, they're going to fill in the holes for us, and it's only going to cost however much dollars a month we want to put in. Let's start with $3,000 a month. Well, what we find out after we sign up for this freaking contract from our aesthetic brand marketing, our website that we didn't call ahead of time, is that by them doing that, we can get in trouble with Google, and you can get blackballed by Google from trying to blanket the market, and then they can shut you out. I mean, you've got to have somebody who knows what the current Google rules are, and they need to be in charge. So we got the hell out of that as quick as we could and learned our lesson and got wrapped on the knuckles. But get the experts. If you see somebody who's got a great website, who's doing their website, can they help you with your website? And it's worth, like you said, you can throw money after bad, or you can just do it right the first time.
And we've had more than one website, and I think one mistake, I don't know if we could have avoided or we didn't know to avoid, because we weren't working with an expert, was with the new website, we lost our ranking. And so that was a bit frustrating, and we had to rebuild everything all over again. But when I think about maybe mistakes that we've made in marketing, because we had been doing direct mail for so long with success, we were really slow to recognize, unfortunately, when we should back off on that and really enhance our internet marketing more. So we had to go through that transition and learn that lesson the hard way. Now, if you're young and you're not doing much direct mail, I feel like it's still something we need to do. It's one of the table legs to our whole marketing plan. But you probably wouldn't have to make that mistake. But that was one thing that happened, even though we were tracking, like Scott said, you've got to have your front desk on the ball and tracking everything and looking at it and reassessing all the time. But fortunately, we have really, our front desk will put a survey in front of a patient that's leaving, and we've got a really good system in place so that we can get those reviews on Google, and that's really been helpful.
The mistakes we have made and are still making every day is something that on top of my mind thinking in terms of marketing every day. It is like if you want to build this 10-story building and to be incrementally the most productive, you want to start out with 0 floor rather than go to a building has 9 floor already. So for us as business owner, it's all about cost effectiveness of the time resources we spend, ranking it, and spend on the top one. For us, the top one, which will represent most incremental gain in market share with the unit time and the resources spent, is social media, or our ability of lack of in doing it. Social media has Karla's all the advantage that she talked about, give consumer the product at the time they want, the manner they want, the type they want, give them a sense of control. But social media, I found, here's the most startling observation. If you assess if we ask all business owners today, is social media important? Every business owner says yes. Then follow up with second most telling question. Are you doing much in any organized way? No. How can something everybody recognize is the most important, but really nobody's doing it in any meaningful organized way? The point obviously is don't know how to do it. Nobody knows how to do it. Social media is a vast ocean, and many problems affecting how to do it. For example, how do you monitor return on investment? How do you monitor staff productivity who has been assigned to do social media? Number of clicks that she or he responded? I don't know. So I think these are the areas we need to work with experts, such as Karla's company, figure out how to do social media. So as business owners, we no longer stay at this very contradictory status of matter, which is everybody recognizes social media is important, but none of us is really doing in any organized, intentional way.
Awesome, thank you guys. Well, let me ask you this question, and this is for anyone who wants to jump in and answer it. Some physicians may think that it's a bit of a faux pas for physicians to advertise, that you shouldn't be putting your name out there, you're in the medical community, people should just know about you, come to you based on the service you provide clients. What would you say to those medical experts who might have concerns about branding and advertising themselves?
I'll take that or start. Yes, I was the dentist. You're that dentist that markets so much. I can't tell you how many times I've heard that. Probably from someone, like Scott was saying, who was next door, who weren't getting too many new patients too. So people just look at something different as being a little bit wrong at first. Now I think we're past that in the medical community. I really do. But it's just about, you've got to get your story out and your name out there. It used to be 3 to 5 times before somebody would remember it. Now it's 7 to 9 times or maybe more.
It's 11.
Okay.
11 impressions.
Okay, because we're just so overwhelmed with everything. But, you just have to press on and keep doing it.
I would say, MDs, we're not past it yet. I think dentists have been ahead of the game on marketing. They've been ahead of the game on how they work with insurance companies, way ahead of the rest of us. Mary and I have talked about the hardest thing when we got together in 2002 was to market ourselves, because when we trained, you did not advertise. And it was beat into our brains, that is unethical, don't go after patients that way, you be a good doctor. But times are different now, and people don't know you're a good doctor unless they see your face. And then you've got to educate, like we talked about. They've got to be able to be educated by your website. It's a different time. I'll bet you everybody who's going in to get their gallbladder out is now Googling laparoscopic cholecystectomy. And there's not very many general surgeons out there, but they all think they need to go to the center that does it because that's the only website available. So we got to get over it, but you just got to be ethical about how you do it.
I agree with everything that Dr. Haws says, and I was definitely one of those people that, and I still struggle with it.
It's hard.
Listening to Dr. Wang's presentation, I think he has the educate. I think is something we all can kind of wrap our brains around, and if you can just figure out, a little bit different ways to educate, and because the market is just saturated now with, there's just so much to choose from, and people have such easy access to all the different choices, so it's hard to differentiate, and I think I would tell somebody those days are gone.
I think if you believe in what you're doing and you're really helping people, you should be okay with spreading the word that if you really believe in what you're doing, I think that's fine. You may get some pushback from your colleagues, but I know dentists are kind of trained not to market, but I think that day's passed, and you may get some pushback from maybe even some jealousy if you do better than people close to you. But for me, I've just had to get over it, and I don't feel bad about it at all. Like I think I'm providing good service, like I'm taking good care of my patients, and I'm okay with getting my name out there for that.
That's a really good point. If you're providing a good service, you believe in what you're doing, and your doctor is your brand. Like for our office, we've got a pretty small office, but Dr. Bergdorf is our brand. It's who patients are coming to see. We have to, when patients call in, we've got to let them know about his training, his certification, his bedside manner, his heart of a teacher that he has with his patients, and those things. So if patients don't know that about him, because they do, patients have a choice, and with cosmetics, it's a little bit more, I think the cosmetic physicians kind of see that a little bit more because we know that patients are researching and choosing, but even with insurance-based things, they've got a choice in where they go. It's not just, my doctor referred me to this doctor, that's who I'm gonna go to. We'll still have patients call 4 or 5 different doctors, even though they've been referred to another doctor. So you have to market and let patients know that you're out there and differentiate yourself so that you're standing out.
Great. Did anybody else want to comment on that one? So Nashville is really booming these days. We have a TV show, a couple reality shows, a lot of new people coming into Nashville. That means a lot of competition as well as potential new patients. So as Nashville is experiencing this boom and this rise, how do you guys plan for that? How do you think it's going to affect your practice and your marketing going forward? And I'll open this up too to whoever wants to start off. Any volunteers for that one?
Well, as more people move in, they're in dentistry, we are looking at, do they have dental insurance? So we don't want to let that be the primary goal because that's not differentiating. But we have to take that into consideration because more of that's going to come in with the population growth and the economic growth too. But that means more than ever we need to differentiate ourselves, and that's really our plan.
That's hard. We've talked about, I think,
It's a work in progress.
every new restaurant that has a hostess has probably got something aesthetic that she wants done, and I hope she makes enough money to want to come see me to have it done. But I want her to choose me, so it's just continuing to do what you do and be available and keep ahead of your reviews and be there. I've thought about getting a big 50 by 50 foot poster of our faces and slam it on the side of the convention center, but I'm pretty sure Carl Dean would not be happy with that. But that's really all I got.
I'm still thinking. I think it's just, I have one statistic, and I'd be interested what you say about this, Karla, but the second most, after restaurants, the second most popular thing to look at reviews is doctors and dentists.
I think it's just good for everybody. I think there's more patients to go around. I think you have to be less competitive. So I don't think there's anything bad about it. I'm enjoying the growth as Nashville gets more expensive to live in. There's like an exodus up to Hendersonville, and I'm just kind of riding that wave. So I don't know if I'm marketing that well or if I'm just in a good location.
Yeah, we have the same feeling. More people that come in, there's more patients to put in our funnel and keep up with and market to and provide a great experience to. So just being through everything, growth and recession and whatever it is, being consistent. Once things get normal, back to normal, or as they continue to grow, as long as you're being consistent and providing that experience that the face of your practice and the website shows, then you should continue to do well.
Great. Any other thoughts for
I
that
might
one?
add one other thing, because you see, we believe in my practice, I'm not in competition with Scott Harbin. I'm in competition with big screen TVs and bass boats, okay? And we have to educate. We have to continue to educate in a delightful way, as delightfully as we can.
This is a benefit coming to a conference like this. Karla's question actually just made me think. I didn't have an immediate answer, but I now have a chance to think about it. Nashville used to be called son-in-law town. If you happen to be the son-in-law of a Belmead traditional Southern family, you get the construction contract. Today, not anymore. Less and less so every day. So with the increasingly mobile population incoming, there's an increasing less loyalty of patients to us as well. Existing patient has more attrition in a more mobile, fluid society. And so not only attract new patients, but also existing patients have less loyalties as well in a city which is more mobile. And so I don't have immediate good answer, but certainly I think capture the new arrivees. What do they get information? Obviously, in addition to internet, what are the typical channels they get information when they settle down in Nashville? That would be a great, very productive area to look at.
Thank you. Great answers, guys. We'd like to open it up so that you can ask a couple questions that you may have to our wonderful panelists up here. Does anyone have a question that you'd like to pose?
I have a question. I'm in the marketing field. I actually work for the Sailor Music Network, the Christian Music Network, and I've worked in television, so I've been in marketing a long time. I would love for you to share what I see in my business is that advertisers of any level, certainly people of expertise like yourself, specialists, one of the biggest things that I think keeps them from advertising at a level that would be effective is just fear. Just how did you guys get past that? Because there is that window in all advertising where you step out in faith and that message has to be consistent, and maybe the phone's not ringing as fast as you wanted, maybe the customers aren't flooding into the door because branding and differentiation takes some time. What made you guys different where you said, I'm going to invest in my business and I'm going to do it, I'm going to be focused and strategic and differentiate, and then I'm going to be consistent enough to give it time to work? Because what I see in my business is people quitting before payday. They throw it out there, what I call spray and pray. They're so scared to put advertising in a certain, rather than seeing what's, figuring out what's the best use of their dollars, what audience they want to capture, and then speaking to those people to the point that gets them to return. What they do is a tiny bit here, a tiny bit here, a tiny bit here, because they're so afraid to step out, and then none of it works because they fall under the baseline of being able to get an advertising campaign to work. So I would love to know, what made you guys say, okay, I'm going to stick with it for a certain amount of time, because I realize that that's how long it takes, regardless of whether the phone's ringing off the hook immediately.
Who wants to take that one?
Mary got started on our website when I was coming to town and we were starting a new practice, because she had been here for 7 years. We needed to differentiate that she was no longer with the group she'd been with before, and it was she and I. So we started with the website. She also had gotten practice management software where we track every phone call, gets put into the computer, every phone call, how did you hear about us? So we track those things. And it used to be other patient word of mouth, doctors 1 and 2. Rapidly, it was word of mouth and internet. And in the last few years, it's internet first, word of mouth. Once we saw internet was even on the horizon, then there was no going back, and it was realizing, wow, anybody who comes from the Yellow Pages is not a good patient, and anybody who comes from the internet is probably going to schedule.
I think it's that piece of believing in yourself is kind of what, and if you can maybe convince your people, come on, are you good or not? And if you are, and you believe that you are, and you really believe that you're taking good care of people, then I guess that leap of faith that, okay, it's okay to advertise, which it's hard. It's a hard hump to get over.
There's two kinds of marketing. There's branding and there's direct response. And branding's great, but it's hard to track. And I'm not Coca-Cola, I don't have that budget, but direct response, I can send out a mailer. I got 20 patients from it. They average $500 in sales. It's a trackable number, so you can test small that, and you take what's working and you just ramp it up. So, and then the branding comes as the practice grows. So that's been the only way I've been able to figure it out. I'm an old Dan Kennedy guy. I got lucky and met Karla and Costas 5 or 6 years ago. They kind of mentored me. I do most of my own marketing. So that, I think for small businesses, that works pretty well.
I know that from a staff standpoint with a doctor, doctors are very impatient. And you have to, Dr. Bergdorf, you have to like encourage them, and sometimes you kind of have to encourage each other, and we have to, and from our standpoint, we're very big on the tracking the things too, so doctors can use their staff as if they are actually asking those questions. Okay, we didn't get 100 phone calls today, but we got 5 phone calls off of what we just put out, or we're able to track that. So if you're seeing that it's working, you just have to give it the time to keep going. And some of it's trial and error, and some of it's you just got to roll with the punches. You're gonna throw something out there and it's gonna tank, and you're just gonna say, all right, we're not gonna do that one again. So you just kind of have to see what works and see what doesn't, and encourage each other as you're going through those humps, because when you have a doctor who says, all right, we did this, where is it, and you're just like, okay, well, it takes time, SEO takes time. You have to kind of just remind each other that, and remember that, okay, we got this many phone calls today, we scheduled this many patients, and never lose sight of what you're doing and why you're doing it. If you only get 1 patient a month until you're building up, or whatever it is that you're doing, I mean, you have to start out somewhere, but as long as you're being consistent with that experience, and you're doing the very best you can with every patient, it'll continue to grow.
Great. Does anybody else have a question they'd like to ask?
My name is Mike Creef Williams. I'm just a mild-mannered mortgage guy in Middle Tennessee. And this is fresh on my mind because I had a heating and air service call yesterday. But one of the best companies I've ever seen that does customer service follow-ups to retain existing customers, if I might say this, I don't get paid for this, but Hiller Heating and Air. Because I know they're gonna touch me at least 8 to 10 times a year. In your fields, what are you doing to retain those customers from a follow-up call, email, follow-up? I mean, how do you structure that? What do you do?
I'll speak to that. We have a lot of systems in place. If a new person calls, whether they make an appointment and show up, or even if they don't make the appointment, for every new patient that I see in my practice, I write them a personal handwritten note. And it takes time, but it doesn't take that much time. And we staticize a lot of things, but I don't know for sure if everyone that I write a note is showing up to get their fillings done. But I have this feeling, and that's not a good thing just to have. You need to staticize, but and then I call them at night after a procedure. I'm sure everybody here on this panel does that. And and our staff calls them 3 days later. So those kinds of things are how we try to get those touches on those patients. So.
We, with our practice software, we track if we haven't heard back from a patient within a set amount of time. My scheduler may call and touch base with them. We send them a survey after they've been to see us. After they completed procedure, we send a survey at 2 months. We sign people up for emails, and we do monthly e-blasts just to remind them what's going on in the office. And it may be Merry Christmas, get 10% off skincare, or just Merry Christmas.
It basically comes down to get the right software that's going to send the ticklers up. And
To
and then
remind you.
And some of them aren't good for you, just get rid of the ones that don't work. And if it's all the personalized ones, but there's pretty good software that helps us.
We have a software program that does some of that stuff. Like, we're not really taught all this stuff in school, so I would guess like the medical and dental profession we probably don't do stuff as high level as some of those companies who have MBAs and stuff working on it. But when we do it, it really differentiates us from a lot of our other colleagues, I think. So, but ours is mostly the software.
Ours is the same thing. We've got a software that kind of keeps up, and our staff is consistently every day going through that list of, we haven't seen this patient in this long, let's touch base with them. And it takes some time on the setup, so when you find the right software, take that time and really go through every single action item and look at each type of customer or patient or whatever it is and say, no, this is a breast aug patient. We're probably not going to see them again after a lot of patients, if they're happy, they're not going to keep some of their appointments. So how do we keep those in, and at what time frame do they tend to kind of fall off the radar, and make sure that you're getting each different type set up correctly. And once you do that, if you've got the right software, it makes sure nobody falls through the cracks.
Any other thoughts for that one? We have time for one more question. I think I saw a hand over here.
Anybody else over there?
It's yours if you'd like it, or we've got another one back here. It's going to you. He passed the gift along.
And this may probably be a short question. I'm David Gilpin. I'm trying to build a facial plastics business here in Nashville. 2 questions, and I think Dr. Haws, you said reviews. I love how you said it's the word of mouth. My fellowship director, it's all word of mouth, but word of mouth is reviews. How do you get your patients? My problem is I don't want to ask my patients to review me. And we'll just give them 10% off their Botox. Why? That, I think that's
Paying for review.
That's paying for a review.
Yeah.
How do you do that? Second of all, who in your office manages all of this wonderful advice that we've heard? I don't think I can do it by myself. So who in your office does that? Thank you.
Karla. We started with printing up cards that had like health grades or vitals as 2 of the companies, and people that were happy afterwards, hey, if you're really happy, would you go on? And I bet less than 10% of them actually go on. We also are using Real Self, which patients freaking love that site. It's unbelievable. And with Real Self, you can ask them if they want to give a review, and you can have an email sent from Real Self that will be a direct link. And that's the 2 things. Now, do we have bucket loads of reviews? No. But again, like you said, the hardest thing is getting over that hurdle of saying, okay, so you said you're happy, would you review me?
Well, how many reviews are people really gonna? I don't think you need 10,000 reviews. I mean, when I ask people, you get that person that comes in and they're so happy, and you do feel comfortable asking them for, oh gosh, Dr. Gingrass, I'd love to do that for you. I read all those reviews before I came in. So they are reading them, and I don't know that you need, maybe you do need 10,000 when you get that psychopath that tries to smear you, and that's why we were so slow getting into it. I was scared. There are unhappy patients out there. Of course, not mine. There are. And it's how how you manage your unhappy patients, or your complications happen. If you operate it up, you got complications. So that was the hurdle that we had to get over with the review thing. And I'm getting more comfortable, kind of seeing that window where they are saying, oh, I feel so much more confident. I bought a bikini this year, or, whatever. Oh, would you mind? I just, it's becoming increasingly important, and I'd appreciate it. And people are usually pretty, if you've established a rapport, it's getting easier, but I understand that.
Our Dr. Bergdorf has no qualms about asking patients for reviews, but if he forgets, our practice management software has an action for every surgery patient, depending on the procedure, how far out. Some are quicker. Rest dog, we can ask patients 8 weeks after, because they've pretty much got their final result, depending. But tummy tucks, all that, a lot longer. But we make sure that we've got an action item that says, make sure you touch base with this person on a review. So if they're not an email person, then we'll call them, or when they come in for that final visit, we'll, hand them an iPad at that visit and say, will you do it?
But if it comes from your IP address, then you can get dinged for false
Right, so
review.
you have to set your IP up correctly, so your IT person will do that. I don't understand how it works, but the IT person will fix that for you. Because with Google, they have to sign into their own, so it still helps. And you can, as long as and you never know, if you send an email, you have no idea if they've actually followed through with it. So some of that is following up, and did you get our email? And, with patients that, are truly happy, and they're, the patients of the practice, they're very close with you, you've developed that relationship with them, your staff will be comfortable asking them that too. And if you're not comfortable and you're in the post-op and they're just raving about it, let your receptionist or whoever know and say, hey, would you mind, make sure you ask her if she'll do a review. She was telling me she was happy, and that way it takes the pressure off you saying, hey, tell everybody how awesome I am.
Awesome, well thank you. And I don't know if everyone here is aware or not, but this lovely distinguished panel was part of our book that we did, Medical Marketing, the Health of Your Practice in a Digital Era, as well as 2 other physicians in Nashville. It was a bestseller on Amazon, and we have it actually in the back if you would like it. We are donating all the proceeds, whether you want to purchase it off of Amazon or purchase it here. We are asking for a minimum $10 donation for that book, and we only have a few copies. But all the money is going to the Multiple Sclerosis Society Mid-South chapter over in Brentwood. My mother has MS, and she's been a nurse, so very active in the medical community, which is why we picked that organization to support the funds of this book. So all of these doctors are sharing more insights into that. And I also want to thank them for being here and recognize their achievement as best-selling authors on Amazon. We have some crystal plaques we'd like to give them for their success. So thank you guys for being here. Yes.